Nabi-Hb Vial is used to prevent hepatitis B infection in people who have been exposed to the virus through direct contact with blood or body fluids. It may also be given after a liver transplant to prevent the return of hepatitis B infection in people with previous infection. This medication is made from healthy human blood that contains high levels of antibodies to help fight hepatitis B. Be sure to ask your doctor or pharmacist if you have any questions about your specific brand of Nabi-Hb Vial. The daily dosage and optimal timing for taking this medication should be determined by your healthcare provider. If Nabi-Hb Vial is used to prevent hepatitis B after direct exposure, a healthcare professional will administer the injection into a muscle. It's important to receive this medication as soon as possible after exposure to ensure its effectiveness. Your doctor may also recommend vaccination after receiving this medication. If Nabi-Hb Vial is given after a liver transplant to prevent the return of hepatitis B infection, it is administered by injection into a vein by a healthcare professional. It should be given on a regular schedule, and you can mark your calendar with an appointment reminder to help you remember. The dosage and schedule of injections will be determined by your medical condition, weight, and how you respond to the treatment. Some common side effects of Nabi-Hb Vial include redness, pain, or tenderness at the injection site, as well as nausea, vomiting, fever, chills, dizziness, headache, or back/joint pain. These side effects may lessen over time, but if they persist or worsen, it's important to speak to your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people who use Nabi-Hb Vial do not experience serious side effects. While it's rare, a serious allergic reaction to this medication can occur. If you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects that concern you, it's important to contact your doctor or pharmacist right away. As always, if you have any questions or concerns about the side effects of Nabi-Hb Vial, don't hesitate to reach out to your healthcare provider. Serious side effects of Nabi-Hb Vial may include blood clots, such as pulmonary embolism, stroke, heart attack, or deep vein thrombosis. You may be at higher risk for blood clots if you are an older adult, severely dehydrated, have a catheter near your heart, or have a history of blood clots, heart disease, or immobility. If you use estrogen-containing products, this may also increase your risk. It's important to discuss these risks with your doctor before using this medication. To reduce the risk of blood clots, make sure to stay properly hydrated before and after taking this medication. If you are receiving this medication through a vein, the risk of blood clots may also be reduced by infusing the medication more slowly or by using a less concentrated form if available. Seek medical help immediately if you experience any of the following side effects: shortness of breath/rapid breathing, chest/jaw/left arm pain, unusual sweating, sudden dizziness/fainting, pain/swelling/warmth in the arm/leg, sudden/severe headache, trouble speaking, weakness on one side of the body, sudden changes in vision, or confusion. Before receiving Nabi-Hb Vial, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. Also, let your doctor or pharmacist know about your medical history, especially if you have any bleeding or blood clotting problems, or if you have a certain immune system problem. Nabi-Hb Vial may cause dizziness, especially when combined with alcohol or marijuana. Avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limit your alcohol intake and speak to your doctor if you are using marijuana. Since this medication is made from human blood, there is a small chance of getting infections. It's important to consult your doctor or pharmacist for more information about this risk. Some immune globulin products are made with maltose, which can cause false high blood sugar levels. If you have diabetes, check with your doctor or pharmacist about the product you are using. It's important to be aware that this medication may prevent a good response to certain live viral vaccines. If you have recently received any of these vaccines, your doctor may have you tested for a response or have you vaccinated again later. If you plan on getting any of these vaccines, your doctor will instruct you about the best time to receive them for a good response. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. It is also important to consult your doctor if you are breastfeeding, as it is unknown if this drug passes into breast milk. Drug interactions can affect how your medications work and increase your risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor. This medication may interfere with certain lab tests, potentially leading to false results. This can have serious consequences, so make sure your lab personnel and healthcare providers are aware of your medication use and the type of blood sugar testing strips you use. If someone has taken too much Nabi-Hb Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center for assistance. If you are prescribed Nabi-Hb Vial, your doctor may schedule regular lab tests to monitor your antibody levels. It's important to attend all of your scheduled medical appointments and consult your doctor for more information. Be sure to take each dose of Nabi-Hb Vial as directed by your healthcare provider. If you happen to miss a dose, consult your doctor or pharmacist immediately to establish a new dosing schedule. This medication is administered in a medical setting and should not be kept at home. It is used to treat anemia in people with chronic kidney disease and those undergoing chemotherapy. The dosage and frequency of administration will be determined by your healthcare provider. It is important to follow their instructions carefully. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.